Morning, this is Dr. Morgan and I am with Chambers Medical Group. I'm an orthopedic surgeon. And I was noting the other day that people come in and they rarely can specifically identify to me what body parts have been injured. What we like to establish is something called a differential diagnosis, and in that regard we can hone in on the exact diagnosis. Today we will go over some of those techniques. So as we start to develop our differential diagnosis, there's several tissues we have to take into consideration. The most common is the skeleton or bone. The other things include ligaments, nerves, tendons, and muscles, and we'll come to those as well. But let me show you on the skeleton what we're looking at generally. And most people with wrist injuries, they sustain an injury to the distal radius, and that's the large bone in the forearm. But there's other things that occur. This little bone right next to the radius that's just beyond the wrist joint is called the scaphoid. That bone is frequently painful during an injury and is very hard to diagnose, and if missed, it's very hard to heal. So these are the things that have to be taken into consideration when we're looking at the differential diagnosis. The other things to look at are the areas of the wrist and the hand. So the radius is over here where the thumb is, and this would be the radial side of the wrist, and the ulnar bone is on the other side of the wrist, and that would be the ulnar side of the wrist. So we're going to divide these up into radial and ulnar components of pain and what their diagnosis could be. When we consider looking at palm injuries in the hand, we call that the volar aspect of the hand. And specifically, we're interested in the flexor tendons, which can be seen as these small lines coming over the metacarpals, and they go through a tunnel system. And these fibro-osseous tunnels are tunnels that the tendon goes through, so that when we flex our fingers, we have maximum strength using the tendons. People also develop post-traumatic trigger fingers, where the fingers will get stuck in flexion at times and then trigger or have to be pulled into extension. The other things we have not yet mentioned are the nerve injuries that occur. And most people are very familiar of carpal tunnel syndrome. But carpal tunnel syndrome is this small yellow tube, and that is the median nerve, which comes through the tunnel in the wrist and then goes up all the fingers so we can feel what we're touching and move our hands. In that, it goes through a tunnel, and it is called the carpal tunnel, which becomes very tightened in injury and can cause loss of sensation in the fingers, and loss of muscle tone as well. Once we're done using the flexor side of the hand, and on the dorsal side of the hand or the back of the hand, we would call that the dorsal surface of the hand. As there are flexor tendons on the volar aspect of the hand, there are extensor tendons on the dorsal aspect of the hand. And those extensor tendons also go through a fibro-osseous tunnel, so they're held down tightly at the wrist, and they allow us to extend or straighten out our fingers as well as our thumb and our wrist as well. Also on that side are nerves that people don't appreciate frequently, and that's a nerve that's over by the base of the thumb. We talked about basal joint arthritis, or arthritis at the base of the thumb is a bony problem. This nerve is called the superficial branch of the radial nerve, and that can also mimic the pain that would be caused by a local fracture or arthritis at the base of the thumb. So in consideration of all the injuries that can occur, we have to take into consideration the bony injuries, the soft tissue injuries, including tendons, nerves, muscles, and cartilage. Again, this is Dr. Morgan emphasizing that what we just reviewed is a small sense of exact injuries that can occur in motor vehicle accidents and slip and fall injuries. And they're usually very highly traumatic injuries. So I would recommend highly that you come and see the professionals at Chambers Medical Group. That is both myself, orthopedic surgeon, chiropractic care, and therapeutic intervention, and all the diagnostic techniques that we can provide to better diagnose and treat the injuries that are sustained.